Happy Strawberry Moon, happy Pride, happy 1 year to me going under the knife to become a titless babe. I wanted to make a video to talk about the fact that it's been a year since I had my top surgery, and I wanted to do it kind of as a record-keeping thing, but also because I think it would be probably really helpful for other trans folks, and I kind of wanted to talk about stuff that I wish I knew before the process maybe, or there were definitely positive surprises and negative surprises about everything. So to just kind of I'm gonna talk about those from the beginning of the process, and also show my scars and how they've come along over the past year. There are a couple photos on my grid of various points, but we'll see how they are today. So yeah, I guess starting from the very beginning of this story, in my memory, it was the beginning of 2019 school year, so fall 2019, that I decided I want to start pursuing top surgery, and I got connected with the Gender Wellness Center in Oneonta, New York, and they basically got me set up with a therapist so that I could start working to qualify through insurance, which ultimately did not happen. I was not ultimately covered by insurance. They told me that me not being on hormones wouldn't be a problem, and it was. They didn't say it wouldn't be a problem. They said it likely shouldn't be an issue. Ultimately, it was the issue. But I got set up with a therapist through them. I actually was able to access therapy through them for free through a grant program, which was really awesome to just be able to have free therapy. So a year of appointments later, September 2020, I was scheduled for a consultation with Dr. Thomas Huntsman, who works out of Cooperstown, New York, and through the Bassett hospital system. And I had a consultation with him. In hindsight, I probably wouldn't have allowed a resident to sit in on the consultation, but I did because I usually want people to have those learning experiences. It just felt intimidating to have two people in there with me, and I kind of wish I hadn't. I also got really emotional during my consultation, which I can recognize now as because I felt like I didn't really have a lot of agency. But at the time I thought it was just getting overwhelmed by the emotional aspect of the process. And a big part of that is that I can't say if this is for all of his patients. It certainly was for me. He basically expressed that he determines the incision method the day of surgery, which from what I understand is really unusual, which meant that I didn't really get to decide that. It was kind of told yeah, we're just gonna figure this out and make the decision for you. I felt really anxious about that, so that was kind of a con for sure. And after that, it was the insurance approval process, which was a nightmare, incredibly dehumanizing, incredibly humiliating, to just have to basically call insurance people and just beg. And through multiple series of appeals, I was just continually denied. I had Blue Cross, Blue Shield, Federal Employees Program through my parents at the time, and they basically said that because I wasn't on T, that I wasn't doing, they phrase it as hormone replacement therapy appropriate to one's gender identity. What was appropriate for me was to not be on T, and that was not an acceptable answer for them. I had 4 letters from my therapist, my physician, the head of the Gender Wellness Center, and my surgeon, and they still said, fuck you. So, months and months later, I did qualify for Medicaid, which should cover it, but they were secondary insurance at the time and deferred to Blue Cross Blue Shield's decision. So I ultimately decided to go private pay because I just felt like I couldn't wait anymore and couldn't handle the possibility of getting rejected again after waiting even longer. So that was like the biggest downside of this process by far. It's just like how much insurance companies just do not want to pay for trans people's procedures. It's bad. But I started a GoFundMe through the like incredible generosity of friends and strangers. Like, it was full before my surgery. Even before the day I had to like make payment for the surgery, I think I was fully funded, which was like an incredible positive surprise, that so many people like supported me in that. And yeah, so I think I scheduled in April, and I was still pretty anxious that it was going to get canceled because of COVID or something, but we were into 2021 at that point, so they weren't being so strict with like elective procedures. And so I had like 2 months to wait. I had I think somewhere in that time, maybe in like May or June, I was just feeling really anxious still about the fact that they were going to be deciding the incision method like the day of surgery. And I emailed my surgeon and I said like, hey, can we do a phone call? I'm just like feeling really freaked out. And he was really, really amazing. Like, he gave really thorough and thoughtful responses to like all of my questions, and like that made me feel so much better about it, because I was just feeling really stressed and like I just didn't understand I just didn't feel like I was in charge of what was happening. That made me feel a lot better, and it made me like, it helped me also just kind of say like, this person knows what they're doing. Like, they have clearly like done this so much, and they really do understand like what is going to be the best option to like make everything look the best. I was like really grateful for that conversation. Then like a week or so before my actual surgery date, I had a pre-op, so I went to some facility within their system, and they just, you know, had me take a COVID test, had me just like, they took my vitals, just made sure I was like fit for surgery. I didn't have to travel really for surgery. It was a couple hour drive, but I didn't have to stay, do a flight or hotel or anything like that, which I know made a lot of it like a lot more convenient, that everything was drivable from where I lived, where my partner lived. The day of surgery, we were aware that there was going to be some kind of COVID-based limitation around like how much my partner could really be in the room and stuff, but I don't think I fully realized that like they weren't allowed past the waiting room. So as soon as they called my name, I was alone, which was really freaky, partly because I don't know if I just didn't understand them correctly or if I just didn't know, but I didn't expect that. And it really freaked me out, and especially because I was misgendered by staff and nurses, and I believe my surgeon as well. I do think Dr. Huntsman, handful of times, it's hard to remember, but I do, like, basically as soon as they, had like drawn on me and marked me up and stuff, it was just me and the nurse, I like burst into tears. I was so stressed out and freaked out, and I was being misgendered, and she was super, super sweet about it. She was so apologetic. She said that normally there's like something on the file and there wasn't anything for me, and so she put something in. She like checked in to see if I needed anything else, and like she was like one of those older nurses. I feel like they're really good a lot of the time, and she was really, really sweet, and there were no issues from there. But it just was like, if my partner had been able to be with me and like advocate for me and correct people, it just would have been a much less stressful situation. Aside from that, everything was really great. I met my anesthesiologist. I met one of the residents who was going to be in the operating room. Everyone was really good. They put an IV in, and it was just like saline at first, and then it wasn't anesthesia, it was just like sleepy juice, like to just basically zonk you out before your actual stuff. And honestly, as soon as that hit, like I was out, and then next thing I was like waking up. The biggest like positive surprise from the entire experience was just that I was in so much less pain than I expected to be. I thought that it was going to like hurt when I woke up, and it didn't. And I know I was on painkillers, but even like once those were kind of wearing off, I really didn't have like a lot of soreness. Mostly everything was really tight. It was like, it didn't even feel like an option to use my arms. Like, it's so hard to explain, but it was like, it's almost like they weren't even there. Like it just felt like there was no even like ability to like lift them, which I think was good because it prevented me from accidentally like doing anything. The seat belt was the only thing that was like kind of intense. Like we brought pillows, and that was good because otherwise it would have been like more of a pain. And yeah, I was actually allowed to shower. I had surgery on a Monday. I was allowed to shower on Wednesday night, which was really surprising to me. I expected to not be allowed to shower for like a week. It was really strange to like take the bandages off and see everything and to touch it, because it felt so like numb, or it felt like there was like something over my skin that I was touching through. It just felt like really bizarre. And to see everything, and I had some bruising, and it was like bloody and stuff. The drains, aside from them being like pressed against my side, and then the fact that they're like stitched in, it's not the drain itself that like hurts, it's that like there's a stitch that's holding it to your skin, so if you yank it, it's like yanking your skin, which will like, you will stop moving when that happens. It hurts a lot. Aside from that, I was on oxycodone at night. I slept really well. I just took I alternated ibuprofen and acetaminophen during the day, and that was plenty. Aside from yoinking my drains every once in a while, I didn't have a lot of pain. The ace bandage was really uncomfortable because it was summer. It's hot and itchy, but aside from that, it was fine. I wasn't as good about my support network as I should have been. I wasn't, I think, assertive enough sometimes. My partner was fantastic, but I should have accepted more help and for longer. Probably started driving too soon. I took 3 weeks off of work. I originally planned for 2, but I ended up needing 3, and realistically, probably should have taken 4, just so that I was really comfortable and able to stretch and stuff. One of my scars is pretty stretched out, probably because of that in part. And yeah, honestly, the recovery part was pretty easy. Getting drains out was also pretty easy. Once they snip that little stitch, they just kind of fall out of you. They're not in that securely. But the biggest thing is that I wasn't great about scar care following up. I also you'll see I have a bruise that's kind of lingering. But yeah, all in all, it was really good. Everything went really smoothly, I think. And I can see my timer. I know that this is gonna cut me off, so I'll do a separate one for the scars. But yeah, if anyone has any questions at all, I'm super happy to help, because it's a really scary kind of thing to have surgery, and to especially when you have to do a lot of stuff by yourself. So I guess, yeah, if anyone has any questions about my experience and stuff, please just ask them either in comments or DMs, and I'm really happy to help with that.